over here. I'll just make myself gallery speaker view, just in case it turns out to be me. I'm going to spotlight myself for a second here. And let's go. So, medicine. Lots of you out there are going to be medical students or aspiring medical students, probably more than medical students. So I'm joined with Lucy, Lauren, and Kate today, who are all, in fact, what year are you? Are you third year now, you lot? I'm going to, in fact, switch over to gallery view so we can, in fact, let's start with just a super quick introduction. You can let us know your name and which A-levels you did, and maybe what it was that made you choose medicine as a degree and a career. So let's go Lauren first, Lauren, Kate, then Lucy. We'll go in that order.
Yes, hi, my name's Lauren. I studied biology, chemistry and Spanish at A-level with maths as an AS. And the killer question, what made me want to do medicine? It's a tough one. I always knew I wanted something in healthcare. I really enjoyed helping people, but medicine in particular, it was the combination of healthcare and problem solving, I think, that really drew me to it.
Okay. Hi, my name's Kate, and for A-levels I studied biology, chemistry, maths and the Global Perspectives qualification and geography at AS level. I think I wanted to study medicine I've always been quite a naturally caring person, and I was part of the care team for my terminally ill granddad, and I was inspired by the medical team caring for him, and I think that's when I really wanted to pursue a career in medicine.
And Lucy.
Okay. Hi, I'm Lucy. For A-level I did chemistry, biology, maths and then did AS history as well. What made me want to do medicine? I knew I wanted to do something person-facing. I didn't want to be stuck in an office or a lab, anything like that. And I was really into my sciences in school. And then when I started getting sort of work experience at GP and my local hospital, I realised that that was what I really wanted to do. So yeah.
Awesome. Lucy, can you reframe? You're a little bit of a floating head. Can we just pull your screen down just a wee bit? See some shoulders. Wonderful. My first question, that is wonderful. My first question from me is, how does actually doing medicine at university compared to how you thought a medicine degree was going to be? So let's go back in the reverse order. Let's go Lucy first.
I think this is a hard one. My idea of what a medicine course might have been, I feel like, especially in first year, I maybe thought that there'd be a bit more placement based. There might be more time in hospital, more time gaining experience, but a lot of first year is just building that foundation of knowledge and then to take you forward in the other years. And it's only really sort of this year in third year, when we're primarily placement based, that you start to get really into your placement and really start to understand how a doctor works in a hospital, the role they play and things like that.
Kate?
Yeah, I agree with Lucy on that one. But I think it's really important that we had the opportunity to, understand the basics, the anatomy and physiology, and then build upon that with more and more placement exposure as the years go on. And I think particularly this year, as it's mainly placement based, it's really enjoyable, interacting with patients on placement and, learning the role of a doctor.
Yeah, and for me, I think, well, when I was doing my A-levels, the main goal was just getting into medicine. I knew what I was, I think I knew what I was getting myself into. But now in medical school, it's really hit that is continuous learning. You never really stop. And even as a doctor, just seeing the amount of training that is required to get to the top levels, and just think that, yeah, you never stop learning. I think that's something that's definitely become apparent in medical school.
Okay, yeah, great. And I think all of that really valuable. I found it quite hard. My degree was biology, so it was kind of like very much just a continuation of very different learning styles at university versus A levels, but the content was very much the same. Which of your A levels were, how much did you use your A levels, and which one was the most useful to you, would you say? Anyone got anything? Anyone can chip in with that one.
Okay, I would say biology was probably the most useful for me. Although I did find that when I was applying, a lot of universities were more focused on you having chemistry as an A level, but not biology. However, I found that biology was more useful for me, especially in the first few months of first year. You're doing what's called foundation blocks at Liverpool, and that's sort of a revision of A level concepts. And that's sort of bringing everyone up to the same level, and A-level biology really helped with that because you had most of the base knowledge for that.
Okay, great. Do you broadly agree or disagree? Anything to add there, Kate and Lisa, Kate and Laura?
I think, yeah, I definitely agree with Lucy that the knowledge from biology A-level you do use a lot in first year. I'd say the teaching style of chemistry at A-level, you know, the mix of learning the theory with the kind of practical experience is quite similar to the teaching style, because I learn a lot from placement, but also in the earlier years, you know, from the theory. So I think that's quite similar to chemistry A level.
Yeah, I would agree with both of you. I also think now we're in third year, trying to come to diagnoses. Now we've learned what about the different diseases and what's normal. I think the problem solving side of chemistry is suddenly becoming more apparent and more relevant to what we're doing now.
Yeah, absolutely. I mean, I know that chemistry is more often a prerequisite for medicine than biology. And that was why I was interested in asking that question, because it would seem to me from an outsider's perspective that biology might be directly more applicable to some extent. Lots of obviously just knowledge, lots of information to learn in medicine, you know, all the names, origins, insertions, ligaments, tendons, physiology, all the kind of crazy stuff. And biology is quite heavy on the remembering stuff rather than the being able to do stuff end of the things. Had a question from Yasmin. Do you have to read lots of medical books? And before we answer, I'm just going to invite anyone here who has any questions to let them be known. We're going to try and follow a relatively logical order from A levels through to what universities are like, and maybe potentially what exactly Liverpool University is like, and questions about getting to university. So we will save up your questions, and yeah, we'll try and answer every single person's question as best we can. So just a reminder, do you have to read lots of medical books? Let's go Lauren, and then back around the other way.
I think, well, it depends what you mean by medical books, but when I was applying to do medicine, I found it really useful to read books written by doctors, just to get more of an insight into their job and their daily life, what keeps them going and what inspires them. So I'd really recommend that if that's something you're considering.
Yeah, I'd agree with Lauren, definitely. I found before going to interview, particularly reading like the GMC guidelines, that was really useful in understanding the roles and like the requirements of a doctor. And then in first year, there was quite a few different medical books which were useful and relevant to our study. I also found flashcards really useful for learning anatomy. That's probably what I'd say.
And Lucy, I'm just going to jump in there. There was an additional question that was from Jazz. Do you have any further reading recommendations? I guess the context of that is very much sort of the medicine applicant rather than the medical student. So I'll double back I'll let Lauren and Kate think about that. But Lucy, you can have those double-ended questions. Do you read many medical books or have to? And any further reading recommendations? We've had one like anything written by doctors, basically.
In terms of before, whilst I was in the application process, I don't think I read any medical books per se, like similar to Kate, read up on the GMC guidelines, the pillars of the NHS, things that you might get asked to interview, just to be up to date on relevant healthcare news, things like that, but not necessarily any sort of books on medicine necessarily.
Okay, great. And anything you'd recommend to a student who is looking to apply? Anything you've come across, or any good, interesting stories that maybe shed some insight onto the real world of doctoring?
Just obviously what I've just said about make sure you're up to date on any news. And And also I think there's quite the popular book written by the doctor, This Is Going to Hurt, which I think a lot of people have heard of. It's quite popular now. But I'd obviously only read that once I was already in medical school, but I found it quite entertaining. To a good read, that one.
Okay, great. Lauren and Kate, did you have any additions for like suggested further reading?
I think prior to interview, as I mentioned, the GMC guidelines and also confidentiality, Gillett competency, the Fraser guidelines are really important to be aware of and to have a good understanding of.
And for me, I'd suggest if there's a particular area of medicine you're interested in, there are some more like specific books like Prison Doctor is one I've heard of, or War Doctor. So similar things like that, just to get a different side of medicine. Yeah, interesting.
Yeah, I know from lots of the panel discussions we've done about medicine and interviews before, there's quite a lot on ethics, or there's quite a common question in medical interviews about ethics. Do any of you have any tips or resources or things that you may have done to brush up on your sort of ethics interview question type stuff? Kate, I saw you nodding there.
I'd say just really be aware of the pillars of medical ethics, and then practice as many questions as possible following these pillars. I think the medic portal was really useful, giving different scenarios, ethical scenarios, and just really knowing those pillars and working through them.
Fab. Okay, and if you think of any others along the way that pop into your head, just don't feel shy, just shout them out and let us know. Okay, so this question, people talk about the difficulty in quotation marks of medicine. Do you agree, or how do you feel about the I guess that's workload as well as intellectual challenge, and maybe some comparison to A level, which is a different set of difficulties? You're juggling multiple different subjects. And so, yeah, some thoughts about the difficulty of medicine. Lucy, how do you feel?
I would say that compared to A level, going into first year medicine, I don't think there was an increase in level of difficulty initially. It was more an increase in workload. There was so much more content to cover. Personally, that's what I felt. It wasn't necessarily that it was more difficult. And then I feel as you begin to build on that in different years, but I don't feel like it's necessarily more difficult. It's just a different way of learning, I would say.
Yeah, fab. Yeah, I totally agree. From my experience of doing biology as well, also not only was it more work, but I had lots of lectures and labs and stuff like that, which I'm sure is very much the case with first year medicine, is like a heavy lecture schedule. But in fact, with medicine, did you have to sign in? The medics at my university had to have something like an 85% attendance rate, whereas they were the only students who had to sign into lectures, whereas in biology, we could just turn up or not as we wanted to. So was there a mandatory element to your teaching side of things?
We didn't have to sign in for our lectures, but they would do random scanning. So they'd pick on any given day, pick a lecture and then scan who was there. So you never really knew when it was going to be checked. So.
And was there like an attendance quota? You had to be present?
Yeah, I think if you dropped below the 90% is when they would sort of pick up on that, and then you'd sort of be brought in questioning, as it were.
Okay, so Lauren and Kate, difficulty versus A levels, or differences, again, I guess, difficulty and differences to A levels.
I think one of the main things of university is, well, most people living away from home, there's a lot of other things to adjust to, as well as the whole new course and new type of learning. So I think that's something to take into consideration as well. Yeah, it takes a bit of adjusting to.
Yeah, and I think in first year, because we learn by system blocks, and then at the end of the year we had summative exams, so you're required to like have a knowledge of all those system blocks. I think it's important to like time manage how you were going to revise, you know, what you were going to do at a set time, and to make sure you covered everything.
Yeah, okay, that's, yeah, and balancing that time and workload as well as time away from work as well, you know, that play time is also really important as a student, and there's no one telling you what to do. You're not there. Well, you may be staying at your parents' house. I mean, that may be a choice that you make, but for majority of students, they're probably living in student accommodation surrounded by other students who are quite often a bit of a distraction some of the times. Although, did you tend to live with medics in your first year? Did you surround, like, who were your core friendship groups? Were they on course or from social groups, or were they sport groups? How did that play out for you? How about you, Lucy?
In first year, so I was in hall, so obviously it's completely random who you live with. I was not in a flat with any other medics, which I actually found quite nice, because obviously you do spend all day with medics in lectures, seminars and things, so it's quite nice to have some time away from that and spend time with people who don't talk about medicine all the time.
Yeah. Okay, Lauren?
Yeah, I was similar. I was in halls, in a flat. I had one other medic in my flat, but mostly non-medics, were who I lived with, and I found like a friendship group with other medics, which I think was really important in first year, because they're aware of like the demands of the course, and so it's good to talk to them about it. But yeah, it's also good to have non-medic friends, you know, away from the course as well.
Yeah, I just totally mirror that with my experience as well. I had 15 hours of lectures a week, which you probably like only 15 hours, but I had 15 hours of lectures and 6 hours of prac. So like, whereas my housemate did like sociology, I think he had 4 hours of like, I don't know what they called it, discussion. And that was his only thing that he had to do each week, read some books. And I was like, so he was forever, you know, come and do this, come and do that. And like, you know, I can't, I've got lectures. But yeah, it's nice to have people who understand your workload, and also have those people who can pull you away from it from time, so you do get a bit of a break. Okay, so a question from AO. Is mentioning ethical ideas, or ideas maybe not the right word, but is mentioning ethical ideas I've come across through work experience worth putting on a personal statement? Obviously, quite a broad question there, but if it's, what would be your take on that?
I think it depends on if there's a particular scenario that affected you, or left a mark and really inspired you, or something like that. But I think with most universities asking interview questions on ethics, I wouldn't say it's the priority in terms of including your personal statement. I think that universities would prefer to understand a bit more about you.
Fab. Kate, you were nodding there. Anything to add to that? Or I think that was a very nice, succinct answer there, really.
Yeah, I totally agree with Lauren. Yeah, I agree. Yeah.
Yeah, I mean, I think maybe that's a question that we can come back to at some point, is like, what are the values or the core underlying messages that you want your personal statement to communicate for medicine, rather than obviously individual details. If you had that profound experience where you were doing work experience and something happened that changes your whole life view about how that makes you want to be a carer and work in medicine, then 100% that is going to be the backbone or the pillar maybe of your personal statement. But just trying to squeeze something in because you think that you should might come across as quite shallow, and it's like it might not resonate as well with the person reading it. So I think a lot of it comes down to like what's underneath what's the value, what's the core below that. So maybe you can have that one ticking away. I'll give you some questions in the meantime. Maybe a quicker one from Yasmin. When do you decide which specialty you want to pursue? So maybe that's something you're thinking about now, because in fact, does anyone want to give me a very quick rundown? You do your medicine degree, is that 5-year standard? And then it's like foundation year 1, foundation year 2. I don't really know how it goes beyond that. If you would take us from the beginning of a medical degree all the way through to what's top, consultant? I mean, you may not even have it, because I know you're a junior doctor until you become a consultant. Correct me. So does anyone want to give me a quick 2-minute review of degree all the way through to consultancy? Any volunteers for that?
It is quite confusing. We were having a chat about this in our house just the other day, because we're still getting to grips with it ourselves, really. So 5 or 6 years at medical school is standard, and then you do your foundation year 1 as junior doctor, and then that's usually a set rotation. It's quite similar to what other people in the same position will be doing. Then there's foundation year 2, as a foundation year 1 doctor, you're only provisionally licensed with the GMC. Even though you are a doctor, it's not until you reach foundation year 2 that you're officially a doctor. And then for most specialties, there's then core training, which is 2 years. So you have core training 1 and core training 2, either a medical or surgical specialty.
Are they a year each? Because foundation year 1 and foundation year 2, they're 2 separate years. So that's 7 years from the beginning. And then there's core year 1, core year 2. So that's 9 years from the beginning.
Yeah, it depends on the specialty in terms of length of specialty training itself. So there's the core 1 or core 2 options, or if someone knows there's a specialty they've always wanted to do, they can go straight into specialty year 1, specialty year 2 training, as opposed to core training. And then once you become a specialty training 3 level, that is a registrar. So you're no longer a junior doctor, you're a registrar. And then depending on the level, the specialty itself, there can be up to 8 levels in terms of specialty training. And then after that, you can be a consultant if you pass the exams and get to consultancy post. But for things like GP, it's slightly different. They don't do core training, they go straight into GP training after foundation year 2. And then for GP, it's 3 years of GP training, and then they're a qualified GP. So as you can see, there's quite a different amount of different options. And in terms of deciding when you want to pursue a certain specialty, it varies with everyone. Some people go into medical school knowing exactly what they want to do. Some people don't decide, they're doing their core training in the medical or surgical specialty and still don't know exactly what they want to do. And there's always opportunities to change as well. I think that's important to remember.
Yeah, I guess once you've done the foundation years, which are, I guess, compulsory for everyone, then everyone's has that, and that you can't take that away from someone, right? You can always go back to it. How about you girls? Do you have any inkling or sort of things that you're toying with the idea of between yourselves? Lauren, if you finish off, and then we'll go Kate and then Lucy.
Yeah, I do have an interest in obstetrics and gynecology. And so in first year, I joined the society. It's called SNOG, so that's the Society of Neonatology, Obstetrics and Gynecology at the medical school. And then this year, I've been on the committee for that society, and I'm hoping to integrate next year in international public health evolving around sexual and reproductive health, because that's kind of just a particular interest of mine at the moment. Great.
Lauren, before we switch back to Lucy, do you know where you might be heading?
We're really proud of Lauren, actually. I have to mention. She's recently got into the army, so she's just going to mention that.
Yeah, I'm still undecided in terms of specialty exactly, but I am planning on joining the army as an army doctor. Within that, there's still opportunities to choose different specialties.
Amazing. Congratulations.
Thank you.
And Lucy, it seems like we've been ignoring you for a little while there, but yeah, over to you.
No, that's all right. I guess the short answer is no, because I haven't quite decided yet what specialty I want to go into. I suppose as we started placement this year, I'm finding things that I definitely would not want to do. And then there's a few things that I'm tossing up that I've enjoyed this year. So, yeah.
Yeah, I think that's often the way, isn't it? Until you really dip your toe into these things, you don't know. And that's, I guess, why there's a foundation year 1, a foundation year 2, and the body is insanely complicated and it leaves lots of room for specialization. Great. Okay, I'm going to try. There's lots of questions coming in. I swear I do have them all here. Questions from Shard and from Yasbin and Tristan. I'm just trying to collate them so that they come in a coherent order. I actually don't. What are PBL and CBL? Can anyone tell me those? Because there's 2 questions about that, and I don't know what they are, so I don't know where to categorize them. Lucy, do you want to?
Yeah.
Okay, I'll just give you the question. If it's out of order, it doesn't really matter too much. Can you talk a bit about your experience with PBL and CBL? Do you find it helpful and manageable? Is the question.
Okay. So PBL is problem-based learning and CBL is case-based learning. Some medicine courses are PBL based. So that is not so many lectures. You're sort of given cases that you work through with sort of like a tutor. I'm not 100% sure on how it works. I know, for example, Hull York Medical School, I think they're PBL based, if I remember correctly. But then you've got places like Liverpool, which is the integrated course that Kate mentioned earlier, where you've got the lectures and the CBL. So that's where you have a set of cases for each system that you'll go through alongside the lectures, that sort of ties it all in together, and sort of really sees how it's applied to a clinical setting, what you're learning at that time.
Anything to add there, Lauren and Kate?
No, I think that summed it up quite well. I think.
Do you have a preference? Which did Liverpool do, and did it play an important factor in your decision-making process?
Yeah, so I chose to go for a course that was integrated with the lectures and the CBL, as I thought the PBL would be much more self-directed learning with not having so many lectures. And obviously that's quite a big jump from A-level to go from sort of being spoon-fed the information to then going straight to self-directed learning with PBL. So I thought that integrated learning might be better for me.
Okay, great. So I'm going to try and do a little bit about sort of like applications, work experience, and then like choosing university as sort of the general course I'm going on. So if you guys watching this have any questions, then feel free to chuck them in and I'll squeeze them in as I'm going along. So, well, work experience, we were just chatting a little bit before we came live about that. There was a question from AO. Do you think virtual work experience alone is enough for the application? And I'm just going to chuck into that any other tips or suggestions of what students may be able to do in current circumstances. And obviously, I guess if year 13s have probably applied already, so year 12s are at the point where they have until medicine and Oxbridge applications are usually just before Christmas, November, December, is it? I can't remember when the deadline for that is, but it's an early deadline for medicine, right? So those year 12 students will have up until that point. So there presumably is going to be the summer and the autumn to do some kind of in-person or work experience, we hope. So yeah, Kate, we haven't heard from you for a minute. Anything on sorry, I'm just taking way too many words here. Virtual work experience, virtual work experience. Do you think it'd be any use, and any tips on getting or doing work experience?
I think it's really important to try and get, and I know at this time it's really hard, but any experience that will be valuable to demonstrate your motivation into medicine, whether this be helping neighbours who maybe are shielded with their shopping, or you know, calling people if they're living by themselves or they're shielded, anything which demonstrates, you know, your caring capacity. I'd also maybe say, I know care homes are probably not taking volunteers at the moment, but if there's any opportunities or any places that you'd like to volunteer in, maybe emailing them, and then as soon as they can take people, you'd be volunteering there. I think it's just whatever you can, you know, try and initiate any experience possible would be good at this time.
Fab. Anything to add from that, Lauren? Were you about to chip in there?
I'd say if you're given the opportunity of virtual work experience, take it. Any experience, virtual or not, is going to be better than nothing, and it gives you something to talk about at interview. Yeah,
absolutely. I second that. And yeah, I'm trying to use the time now as best you can to try and organize something for the summer, when we certainly hope that there'll be more access to do things, and maybe if you can put yourself down as a volunteer to help out in one of these ways. I don't know whether you'll need to be vaccinated or not to be able to go into people's home, but you can always drop the shopping on their door and things like that. There's lots of things that you can at least show the gesture, the goodwill, and that caring side of your nature, essentially. Okay, so okay, can you do medicine without biology but with chemistry and maths, is basically a question. Lucy, do you know if that's, obviously universities have different applications, but how is it with you in your experience?
In my experience, it was that most of the universities liked it for you to have maths, chemistry and biology, but the mandatory ones were maths and chemistry. I'm not sure if that has changed more recently, but that was my experience when we were applying.
I'll just add to that. I actually didn't do maths A level. So most places said chemistry and another science when I was looking at applying. But I would also consider like why. I think universities might ask why you chose not to do biology, and if it's because you don't actually like biology, I think you also got to be aware that medicine is very biology based. So be prepared for a lot of biology in your first year, especially.
I think if you're wanting to know what the different medical schools require A-level wise, the Medical Schools Council website, based on the entry requirements page, is really useful, as it kind of lists the different medical schools and then their requirements for GCSE, A-levels, how they use the UK CAP or the UCAP now. So yeah, I think that's a really good place to look.
Did any of you girls use Unifrog? I think there's a few others, but Unifrog's a large, it sort of helps you find and choose universities. There's a lot to it, but did any of you use it and your experience of using it for medicine?
I don't think I use Unifrog. I use the Medic Portal comparison tool between medical schools, which I think is probably quite similar.
Okay, I'll broaden the question out then. I think, yeah, what online resources did you use and find helpful for what? So yeah, Kate, so Medic Portal, was that?
Yes, yeah. I think it just compares different medical schools and their requirements, so you have a good idea of what they're looking for.
I also found it really useful to work out which universities would be more likely to accept me. Yeah.
Lucy, what did you use when you were sort of choosing your unis?
Yeah, I think Kate just mentioned it, the Med Schools Council. It's Med Schools. I think you just type in Med Schools on Google and it should come up. But that sort of gives you a coherent look at each medical school, how many applicants they have per place. So then if you're thinking where you might be more likely to get a place, how much weighting they put on GCSEs, personal statement, what A-level requirements they like. So yeah, that was really useful.
Excellent. We've got a couple of questions sort of grouped around applying. So, well, first of all, a bit of a congratulations to Tristan. He's got a Liverpool medicine interview on Thursday. So congratulations for that. So the one question is tips for an interview. Okay, let's just start with that. I think that's quite a chunky one. That's quite a big question I think students would ask for. Obviously, you can't say what specific questions were asked, but you can talk about what the interview format was, because I know there's a few different types of interview for medical interviews. So any tips for the medical interview at Liverpool? We'll start with that and maybe broaden out after that. Lucy, how did you find your interview at Liverpool?
So the Liverpool interviews are MMI, so multiple mini interviews, which I think quite a lot of the medical schools are doing now. And it was actually one of I think it might have been my last medical school interview. So I feel like by then I'd sort of got into the rhythm of it. But so there was, I think it was 6 or 7 stations per interview. So there's usually sort of like a calculation station, an ethics station, which we already touched on. I would say before interview, have another read over your personal statement, because they can bring that up in interview and then question you on it. So just make sure you know exactly inside and out what was said in your personal statement. And then they do like to ask about current affairs, so recent medical news and things like that.
Okay, great. Lauren and Kate.
Yeah, I'd agree with Lucy. I think this year, I'm not sure they're all doing MMIs because of interviews being virtual. So I know we all did MMIs though. So that's our experience.
And any other sort of tips for preparing? I mean, it's easy to say, or don't stress too much about them, or try to be relaxed, and like if one station doesn't go so well, put it behind you. Like those things, obviously much easier to say than to do. Any other sort of practical tips that you girls were given or developed yourself?
Like you just mentioned, it's hard, but if one station doesn't go the way you'd hoped, you just gotta refresh yourself and prepare yourself to have a go at the next station, give it your best shot. Just be yourself, and yeah, I mean, you can't do better than your best. So
Yeah.
I'd also probably mention about reading like the GMC guidelines and yeah, what I mentioned before about confidentiality and like other kind of guidelines in medicine.
yeah, I would also add know why you'd want to go to that university specifically. They do like to ask about that, whether it's the course or the university itself. I think that's quite a common question to come up.
Yeah, there was a why did you choose Liverpool as a question. So let me ping that question straight back at you there, Lauren. What was it about the Liverpool that made you want to do it?
When I did my research, I really liked the sound of the course, the integrated learning style. I like the city itself. It's really friendly, welcoming. The locals are lovely people. When you meet them in hospital, they're always keen to have a chat with you. And for me, the decision was actually quite easy because I only got one offer, but it turned out for the best. And Liverpool was probably my first choice anyway.
Okay, we'll go on to you next, and then Lucy.
Yeah, I'd agree with Lauren. I'm quite fairly local to Liverpool originally anyway. So I knew Liverpool as a city and I really liked it. Course-wise, when I looked and came on open days, there's specialist hospitals in Liverpool, which we can go to for placement. I thought was a really great opportunity, like a learning opportunity. And also, as Lauren said, the style of the course as well.
Lucy.
Yeah, so when I was coming to choosing what would be my first choice, whenever I'd been to visit Liverpool, obviously I'd really enjoyed it. Like Kate said, there's a lot of specialist hospitals, and for me it was quite a good distance from home. It's about 2 hours, so it's a good enough distance to go and live independently and feel like you've really moved away, but then not so far that I can't just pop back when I want. So yeah.
And pretty well connected as well, good train links and stuff like that. Yeah, I mean, for me, yeah, the things to consider that I hadn't really thought about when I was choosing universities, the city itself, like campus or non-campus was a big one for me. I didn't want to be out of town on my own campus because I just wanted to be more living in the town or city because I didn't want to deal with transport. It was just something that was important to me. So knowing what a campus is and visiting universities right now might not be a thing. And if you can't do that and the virtual open day doesn't quite do that for you, then by all means, go visit them in the summer. Just go on a little weekend trip when you're allowed to do that and see what the city's like and what the vibe is, and maybe visit the university buildings. For me, I walked into the bioscience building at Cardiff where I went to, and it's just like this beautiful old stone. It just felt like a place that I felt like this is a good place to learn. And I can't really put my finger on it any better than that, but there's basically no replacement for visiting, I'd say. There's only so much you can do online. One more question about application, another couple actually. Very broad. What are the important things to put in your UCAS application? So where do you want to begin with that one then, Lucy?
Okay. So is that in terms of sort of personal statement?
I guess personal statement mostly. It's going to be obviously grade based as well. I mean, there's not too much you can do about that, especially this year. I guess personal statement. We'll give it a personal statement twist.
Yeah, what I would say about personal statement is actually a lot of unis don't put too much weighting on personal statement, or at least initially. I know when I was looking into things, personal statement was more of in a tiebreaker situation, or sort of a borderline candidate. And I know some places, like for example, I think Newcastle, they don't even look at the personal statement. Manchester, they don't look at the personal statement. They give you their own online form to fill out. So in summary, I just wouldn't stress too much about personal statement, I think.
Over to you two.
I'd say it's really important for your personal statement to demonstrate your motivation to study medicine, like at the beginning of it. That really shows, you want to study medicine, and then, go into why, experiences you've had, especially non-academic. As Lucy said, they've got your academic criteria. They know about that. Mention your interests and hobbies, shows you're like well-rounded as well.
Yeah.
And go on. Sorry, Lauren. I will cut you off there totally. Over to you.
I think really they just want to get to know you. And if you say something interesting in your personal statement, you might get a question about that in an interview. They might use that as a way to follow up, and that is a really great way for you to know what's going to come up as well. You can prepare something based on your personal statement, so you can be an expert in that field and just prepare that question for them perfectly.
Okay, great. We've done 40 minutes, so I'll just invite any sort of final questions from the audience, and I've got 3 more on my list here, so we'll just see how we're going and start rounding things off to an end. The final application question that I have in front of me is like, what did you guys use for UCAT or BMAT? There's Medify, there's CATplan, any other resources that you found helpful? How did you prepare? Yada, yada, yada. Kate, let's start with you.
Oh, I've forgotten what the book's called, but there's a book with, I think it was about 250 questions, or you can choose how many questions the book has, and that's just got loads of practice questions, depending on like the different like categories in the UCAT. I only did the UCAT. I also went on a UKCAT training day, and I used the Medic Portal question bank as well. I think it's just really important to just keep going and work on, I think I struggle with the time aspect of the UCAT because there's quite a lot of questions to do in a limited amount of time. So I really like focused on that and focused on strategies to do the test.
Absolutely. Lauren?
The main resource I used was the UCAT website itself, using their practice questions, because they presented it in the way that you'd actually get in the exam itself, and so you knew exactly where everything was going to be, like the calculated bit, and help you prepare for that. And yeah, I would reiterate what Kate said, practice under time conditions, because that is the bit that makes the test hard. Yeah, definitely.
And Lucy, that was pretty comprehensive. Did you use any other resources?
Yeah, I think you said the person mentioned CATplan. I got the CATplan book when I was studying, and I think online also they had a few practice papers which I saved until sort of just a couple days before, because obviously there's only a limited number of practice runs, just to get used to the timing. But yeah.
That is the single best predictor of exam performance that you can have, is the number of real life practices of the exam done. It's not intelligence, it's not even knowledge, it's how many times have you done the paper. That's the single greatest predictor. So timed past papers works for A-level biology, A-level maths, A-level chemistry, any GCSE that you're about to be doing, or for UCAT or BMAT, same deal. Absolutely. Okay, so some about uni and uni life a little bit. So where do I want to begin here? Is it true when you're studying medicine you basically don't have a life? So how about that? Lucy, you're smiling. What do you have to say about that?
I would not quite agree with that, especially sort of in first year. It is true that medics tend to have a lot more work than other courses, but I think it's been said before that medics work hard and play hard as well. So if you make the time, there is the time. Obviously, you have a choice to make on how much time you spend studying. Obviously, you can spend all your time just working and studying, but if you want to make time for other things, there is time for that.
Yeah. Lauren, Kate?
Yeah, I just say I think it's really important at medical school and then following on in your medical career to really get a work-life balance. I think, yeah, that's really important.
Yeah,
and setting. Go on, Lauren.
Sorry. There's plenty of time to do things, and university is your one opportunity to get involved in things like societies and meet so many people your own age. And I personally have managed at least 2 societies up until 3rd year. It has not always been most comfortably, yet time management does come into play, but I think it is important to enjoy yourself as well.
Yeah, absolutely. I'd say setting up that schedule that Kate touched upon, that work-life balance, and like if all you do is work now, then when you end up doing your F1 and F2, that's going to be your mindset that you should only ever work, and you're just going to build yourself a career of only ever working. And that's probably not the long-term recipe for success that you are as an aspirational medical student in year 12 or 13. So absolutely. And there is no better opportunity that I've come across in my life than doing sports or clubs. It doesn't have to be sport. For me, that was what I enjoyed, but it could be art or sculpture or whatever it might be. That there is a society for everything. It's cheap, it's high quality, and there's people of like-minded, interests everywhere. So like, make the most of that. It's one of the huge opportunities that university presents itself with. So I'd say get stuck in. And it's relative, right? It's relative to, I was going to pick a subject then and be a bit mean about them. Relative to some subjects, your contact time in medicine is huge. So relative to some of those subjects, you have much less of a life, but that doesn't mean that you can't have a social life, and you can't have fun, and you can't do sport or play games. That's I'd say not true. Okay, from Shad, did you see a shift in the way that you revised or learned material between A levels and university? And if so, how? Anyone got a thought on that one?
One thing I would say is with A levels, is the recommendation just to do loads of past papers. And in medicine as well, at Liverpool anyway, we don't really have that option because they don't really do past papers. So there are other ways to get around that. There are online question banks and things like that with more general questions. And also just the amount of content. I think those are the two big things that made me change the way I revised.
Yeah, I'd agree with Lauren on those differences. I'd say at A level I learned in a kind of a variety of ways. Sometimes I did past papers and I looked at the mark schemes and saw like the language they were looking for from an answer. That was more towards the end, and then I varied it with watching some videos like Untitled Tutors, and also just like writing notes or flashcards. At med school, I think it's still important to have a varied approach to it. Well, that's how I do it anyway. I do watch some videos if I'm learning something I find particularly difficult. I use flashcards. I've also found it really useful, to revise together, because we're all like revising at similar times. Someone might find something difficult that someone else can like explain well. So that's how I revise at the moment.
Grant?
Yeah, I just like also say that, so coming into uni and medicine, that's what we said, was there's a lot more content, and also the content's not, most of the information is not readily available to you. Although you've got the lectures, there is an expectation that you will consolidate that with sort of extra reading. And so at Liverpool, they offer us like a reading list, just a big list of books where you can find extra resources. So I spend a lot of my time looking for extra resources, for more information. And I think that's what takes the longer time, is collating all the information in one space first.
And sort of summarizing it down to a useful volume.
Yeah.
One thing I was going to say, that we've actually had some former TT students get in touch with us, because it is quite different. You go from A levels, where you have to acquire the knowledge, and it's a national, externally set test sat by all students at the same time. You go to university, and the person who's teaching you the course, or the people teaching you the course, are the people examining you on the course, and there's no external element at all, which makes it it might not seem that obvious, but it's a completely different kettle of fish when it comes to the examination mindset and framing, because they know what you've been taught and will examine you on what they have taught you to some extent. Whereas in you have 1,000 teachers all independently interpreting the spec and what they think may or may not be on the exam based upon what someone else is going to write on the exam. So the person, it is quite a big shift. For that reason, a lot of universities won't publish past paper questions, because they will tweak or recycle the questions year on year. So they might have 3 or 4 years worth of questions that they ask students, but they use them on rotation, which is why they don't make past paper questions readily available at university. I was lucky, and through my extracurricular, I played squash in my sports societies, I knew some people doing my course. at second year and third year, and when they had their exams, I asked them what their exam questions were. So I had kind of a mini bank of past paper questions that I'd gathered myself just by talking to the older students when they had their exam, which I found really useful when it came to revising, because there are very few past papers. Do you have any other little tips or tricks that any sort of secret friendships with older medics that sort of gave you some tip-offs as to what was to come? Lucy,
yeah, there's definitely a bit of that going on at Liverpool, because obviously there's 5 years and there's a lot of like medic societies. There's the General Medic Society, there's different specialty societies, there's the medic sports societies. A lot of things get passed around, different sort of like, there's a lot of sort of teaching that goes on between different years. So we're in third year at the moment. I teach some of the second years. I'm also getting taught by some fourth years and some fifth years. So there's a lot of that going on, which is really helpful.
Wonderful. Yeah, great. I think, yeah, that's anything to add to that, you two?
Yeah, I'd agree with Lucy. Yeah, we're both involved in mentoring younger years and being mentored by older years. I think for medicine, at the end of it, we're kind of the medical schools across governed by the GMC, so it is more standardized, isn't it?
Yeah,
at the end.
Final at the end.
Yeah, finals. But as you
So that's more similar back to the A-level system where you're taught internally and have an external test. Yeah. Okay, so
they're into.
A couple of final questions then. We've done 50 minutes, so we've done loads here. So maybe just a quickie here. What hospitals do you have placements at in Liverpool Med School? So just specifically about Liverpool then. We'll go Lucy, Kate, then Lauren. Just a quick one. In fact, we probably only need one answer. Lucy, let you go first.
Yeah, so there's so many hospitals in and around Liverpool that you can be sent to. There's City Centre at the Royal, it's called. For children's, you could be sent to Alderhay, and for women's, you could be sent to Liverpool Women's. There's also ones further out, so one's on the Wirral, so Arrow Park. There's Warrington Hospital as well, Whiston Hospital, Aintree.
So a huge range, really.
Yeah, there's just a huge range, and we're all sort of got different combinations of different hospitals. They like you to get exposure to different trusts, which is good because obviously everywhere's slightly different. So yeah, we're getting moved around a lot this year.
Okay, two more, and I think they're going to be the last two. One from Kim and one from Jaren. In fact, I'll finish with that one because there's. Okay, so. What books, resources, online, YouTubers would you recommend for first year or getting started in medicine? Yeah, I'll just leave it as an open question. Lauren and Kate?
Yeah, I've got Grey's Anatomy flashcards, which I find really useful for learning anatomy. I've forgotten the names of some. Do you use anybody particular?
I think there's also online, lots of online resources. Like Teach Me Anatomy, Teach Me Physiology, those are both excellent. Anything else?
Quizlet. I've made my own Quizlets and I find them really useful to kind of test myself in a different way.
In terms of like,
sorry, and the recommended reading list that uni provides is also everything you could ever need to know about that topic in first year.
And all the resources by the uni are really good.
Yeah. And Lucy?
I was just going to add in terms of like YouTube, there's Osmosis, which I think some of their videos are free, and then you can have a subscription as well, and their videos are really good. There's also another YouTuber, is it Armando Hussein? I think if you just type in Armando Medicine, some of his videos are really good though, on big concepts in medicine.
Osmosis, I live with a couple of nurses and paramedics, and they sort of would often, they wouldn't use Osmosis as their primary learning source, but often as a recap at the end and then like test themselves on it. They used Osmosis a little bit, which was very good quality from what I could see. And the final one, we're going to just go back to, the broad question was, what online resources do you use to revise? I guess we could put our A-level hat on there, and I guess revision at university is kind of a different prospect. You've got all your notes, just like a way bigger pool of information that you're drawing things from. So we'll go, what resources did you use to revise? And we'll go A levels and universities just separately on those, and as our final question there. So and I'll do a final comment from each of us as well. So let's do Kate, revision resources, A levels and uni.
Yeah, so for A levels, I found, particularly for maths, past papers really useful. Just continue doing past papers, and also for the other subjects, past papers towards, when you're nearing the exams. It's really useful as well, learning difficult concepts on videos, and also if there's any additional help or support from school, like drop-in sessions, I used to attend them if I had a difficult question I wanted to go over. Uni, quite similar, videos, flashcards, revising together, especially at this stage. Yeah, that's what I find particularly useful.
How about you, Lauren?
For me at A level, I found flashcards really useful. Also going through the textbooks and doing the questions at the end of each chapter for biology and chemistry were great. And then again, past papers towards the end. Spanish was a bit of a different one. Read as many Spanish newspapers as possible. And then listen to podcasts and things. And then towards the end as well, practicing past papers.
And Lucy?
Oh, sorry, I was meant to talk about university.
No, I think we've probably broadly got the picture. University is just a sort of a slightly wider, you've got more books, more papers, more lecture notes. It's just a slightly more, in my experience, it was a wider base of knowledge rather than just going to class and having the textbook, which was kind of the two things that you kind of deal with at A level. Lucy, any thoughts on that? In fact, I've got maybe one more question, but that's from me at the end.
So like you were saying about at uni, there's just a lot more resources, a lot more lecture notes, and so as you're going along, you would make the lecture notes sort of thorough, and that's when I would collate all the information from all the resources. And then when it came to revising, what I would try and do is then cut down that information on an absolute need to know, sort of just fit it all on one card, the key points that I got from each lecture.
Yeah, absolutely. I devised what I called it a learning system. I called it FAST, the principles of learning information as quickly as possible. And F is focus. A is making associations and linking things in your brain. The R is repeats. You're just going to have to do some repeats and repetitions of it. The S is summarizing. So that's very much that phase there, taking a wide information base and squishing it down and maybe getting rid of the less important details. And then the T, there's actually two T's. There's testing yourself and then teaching others. So lots of, Lauren and Kate have said they've done lots of group work, teaching one another and peer mentoring and stuff like that. So as a general rule, if you can follow those processes, then it should help you to get information in your head as quickly as possible and cut out some of the less important stuff, like just rereading your notes and those passive things that are less effective in terms of time spent for memories saved. Just a quick, did any of you use teletutors? I know Kate, you mentioned TT. Did any of you, Lucy and Lauren, did you use teletutors at all at your A levels? We would have been quite young in your days.
Yeah, unfortunately not. I hadn't heard about it. I wish I had, but no, unfortunately no.
Well, I had a question just for you then, Kate. Would it have been useful, or was it useful at all to you in your first year university? Like, we have a dentistry student from last year, one of our brand ambassadors who's doing dentistry, and he's asked to keep it for a year so that he can touch up on some of his biology stuff. Would you think it would have been useful, or is it not that relevant?
Just thinking back to first year, yeah, I think it's good to, because we build on all the information kind of on A level biology. So yeah, to look back and recap on a few theories, it would be useful for.
Okay, great. Well, that's it from us. If you do have any if you're watching the recording of this many weeks or months down the line, you've got other questions, we will be doing follow-up sessions just like this, and let us know in the comments rather than in the chat. and then we can sort of collate them all and put them to our wonderful medicine students. A massive thank you to Lauren, Kate, and Lucy once again for joining us. The recording will be available on YouTube Live. We may actually take it down and chop it up so that it make it into a few shorter clips to make it a bit more digestible, but it will be available to all of you guys out there who follow the TT subscription channel. If you have found it useful, it would be great to give us a little thumbs up, help boost the algorithm to help a few other like prospective medical students find it. And if you do want to be kept up to date with our lives, then make sure you subscribe and hit the bell so you get those notifications. Coming up very soon, in a week or so, we're going to have the announcement about what will be happening in terms of the A-levels this year. So the results of the consultation are scheduled to be announced, I think, on the 22nd. So as we have more up-to-date and accurate information on that, we will be here on the YouTube channel announcing that. That is the primary mouth of TT in terms of keeping you up to date with all the latest changes and moving goalposts that is the A-levels over the last couple of years. So any sort of final words of wisdom to prospective medical applicants from each of you? I'll go Lucy, Kate, and then Lauren, and then I'll tie things off and say goodbye.
So in terms of if you apply into medicine, if you get an interview, just be yourself, try and stay cool and calm. And if you get an offer, I would really take the time, so that summer break between A-levels and medical school, to just relax, enjoy yourself. Don't worry too much about doing any extra reading, pre-reading, anything like that, because I really think you need to enjoy yourself in that time before you really get stuck into medicine, because obviously it is quite full on.
Yeah,
Fantastic.
I agree with Lucy. I'd say I know it's difficult this time, get as much experience as possible to demonstrate, your motivation to want to study medicine, and whatever stage you're at, best of luck with everything.
Yeah, I would agree with all of that. I'd also say maybe in an interview they might ask about a backup plan. So if you think that might be the case, think about what you would do in a gap year, and if you consider graduate entry medicine or something like that. But have a go. No harm in trying, and yeah, all the best.
Fantastic. Well, thanks so much to all of you for your time and amazing advice. And yeah, if you have further follow-up questions, put them in the description. We'll put them to the girls and maybe come back again with another interview at another time. See you next time. Bye.